Hi everyone, welcome back to my channel. If you're new here, my name is Neil Galve. I'm a registered nurse and I do have a degree in medical surgical nursing. I create nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you are already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos Mondays, Wednesdays, and Fridays. Please make sure to subscribe now to hit that notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more content like this. Without further ado, guys, let's jump into the video. Hi everybody! Today is the last week or the last day for today's week of discussion. Gets nyo ba? Oo. Ito yung pagtatapos ng third week natin ng May, and this is going to be our last classroom or online discussion. That's what I'm trying to say. All right. And yeah, how are you guys doing so far? Thank you so much for all the love and support that I'm getting all from my previous uploads. Maraming salamat po. I want to welcome all of you who's watching right now for coming into class. I am so dying proud of you. And I want to thank the all new subscribers. Welcome to the channel. You guys are amazing. Thank you for subscribing and sharing my videos to your social media platforms, sharing that space that you have online for me. Maraming salamat po. I really do appreciate. And I would just like to let you know, keep you updated about the current status of our channel. You guys, currently more than 56% of the watch times I get is from my non-subscribers. So I really encourage everybody, if you're watching right now and you haven't been subscribed, please subscribe, because the bigger the channel gets, the bigger the contents, the bigger the more possibilities of creating more fun, more exciting, and more expansion when it comes to our channel. So make it possible, make it happen, because all of the contents I'm doing in my channel or on this channel is all for you. So use them up, check them out, educate yourself, refresh your knowledge when it comes to nursing. If there's any update on nursing, I will be posting it also. So I want this channel to be your number one online go-to resource when it comes to nursing education. Okay. So this is all about, all about nursing care plan, NCP. If you haven't watched the very first upload I created under this playlist, I'll be putting the actual playlist link there. When I give on that video, on that lecture, I actually give you like the fundamentals of nursing care plans, all the terminologies, all of the concepts in regards to NCP. Check that one out because this is the continuation. Okay. So yeah, for you to have the full grasp of this lecture. So today I'm gonna be teaching you how to write a nursing care plan. Ako, Nanda. Diba sa mga estudyante natin dyan, o kahit sa amin, sa area, marami ang hindi marunong gumawa ng NCP. A lot of the nurses are actually not familiar or have different ways of writing NCP based on their, their background education. So, but this is standardized. I believe that this should be standardized and everybody should have, a basic knowledge on how to create the components of your NCP. Kasi mga doktor, meron yan silang doctor's diagnosis. Tayo rin, meron tayong nursing diagnosis. O, diba? Huwag ka mag-alala because later on this topic, I'll make sure at the end of the discussion, you will be 100% knowledgeable and a top-notch NCP nurse, NCP maker. All right. So how do you write a nursing care plan? I'll be providing you the steps on this discussion on how to develop a nursing and effective care plan for your patient based on their needs. Exciting. Medyo juicy itong hindi medyo, talagang juicy itong discussion natin na to. But before I proceed, I would just like to give you time, a moment, to hit the notif bell and subscribe. Go. Okey-doke, ang bilis hindi ba? Eto na tayo. Nagmamadali na tayo ha. I'll be putting all the educational contents I have on the description box. Check that one out, okay? So, ito na tayo. Let me share to you the objectives for our today's discussion. O, diba, juicy? So, step by step po ito from step 1 to step 9. Step 1, data collection or assessment. Step 2, data analysis and organization. Step 3, formulating your nursing diagnosis. Step 4, setting priorities. Step 5, establishing client goals and desired outcomes. Under nun, may sub-content. Meron tayong short-term and long-term goals na i-discuss ko sa inyo. Don't you worry. We also have step 6, selecting nursing intervention. Under nun, we're gonna be discussing types of nursing interventions. There is types. Huwag kang invento dyan. Step 7, providing rationalization. Step 8, evaluation. And step 9, putting it on paper. Meaning, putting it on practice. Hinga ng malalim, ha? Don't worry, if you're watching this video on YouTube, I'll be providing it in chapters. Balik-balikan mo. Okay, itong lecture na ito. Okay, eto na tayo. Let's proceed with step 1, data collection or assessment. Very straightforward tayo sa discussion na to. Go. So we have step 1. The first step in writing nursing care plan is to create a client database using assessment techniques and data collection methods. Physical assessment, health history, interview, medical records, review, and diagnostic studies. That's how those are the informations that you can look up in gathering information. Okay, a client database includes all of the health information gathered. In this step, the nurse can identify the related or risk factors and defining characteristics that can be used to formulate a nursing diagnosis. Some agencies or nursing schools have specific assessment formats you can use. Basically, sa nursing assessment mo, ADPI to, sinusunod natin yung ADPI, ha? Nursing assessment mo, may dalawang klase ng assessment. Subjective and objective datas yun. Subjective, anything that the patient verbalized. Example, I'm in pain. Pain scale, 0 to 10, 10 being the highest. 5 as verbalized by the patient. Objective findings mo, syempre kasama dyan yung pain scale, kasama yung vital signs, kasama yung current diagnosis ng pasyente, not diagnosis, mga manifestations ng pasyente mo. Mayroon bang fetal position, withdrawal from those kind of stuff, okay? So those are the objective findings, the things that you see on your patient. You see, you feel, you touch, using your 5 senses, okay? So that's step 1 of your how to write your nursing care plan. Next, proceed na tayo. Step 2, data analysis and organization. Now, you have all of these data. How are you going to analyze them and organize it in a way that it will correlate to what is your patient's diagnosis? I'll teach you why, don't worry. I'll teach you why. I'll teach you how. So, step 2, now that you have information about the client's health, analyze, cluster, and organize the data to formulate your nursing diagnosis, priorities, and desired outcomes. The way you're going to formulate it, nurses, is you want to be systematic. The way I do it in a cephalocodal approach. Una na dyan, HPI, pathway ng pasyente, kung saan man siya napunta sa ward, napunta sa ICU, ganyan. Next is your HPI, history of present illness. Anong current diagnosis ng pasyente mo? And then you want to start from head to toe assessment. Anong nakita mo sa head, nakita mo sa eyes na nagko-correlate doon sa nursing diagnosis mo? Okay? Because these are the things, the findings. When you cluster your ideas and you cluster the data that you collected, you'll be able to know where to find it, and it will be easier for you to navigate through the NCP. You know what I mean? Okay, to prioritize and to formulate your desired outcomes. Okay? Alright, here we go. So, tapos na tayo sa step 2. Very straightforward yan. Next na tayo sa step 3, which is formulating your nursing diagnosis. Nako, may mga parts pa po ang nursing diagnosis, ha. We have your etiology, secondary factors, kapag may secondary factors, risk factors, we have your manifestations, yung related to, meron ba tayo as manifested by, Don't worry because I'll be creating a different lecture regarding that. Okay. Mamanu-manuhin natin to, isa-isahin natin to. But this is step 3, formulating your nursing diagnosis. Now, formulating your nursing diagnosis are a uniform way of identifying, focusing on, and dealing with specific client needs and responses to actual and high-risk problems, actual potential health problems that can be prevented or resolved by independent nursing interventions and termed nursing diagnosis. Like I said, I'm going to formulate a video lecture regarding separate discussion or video about how to formulate your nursing diagnosis, complete guide and list. Okay, mag-alala. Susunod yan. Sa paggagawa mo ng nursing diagnosis, kailangan mo ng NANDA. Kasi doon mo siya kukunin. Yung ginamit namin sa generation ko, naabutan ko, yung 11th edition. 11th or 12th edition. Hanggang ngayon, nasa bahay ko pa siya. Hindi ko alam kung ba't di ko siya dinadala. Pero sa area namin, we have NANDA. Definitely, we have NANDA. Ngayon, nag-evolve na yung nursing diagnosis ay yung NCP. Makikita mo meron na tayong tinatawag na interdisciplinary plan of care. Yun na yun. So, depende kung anong laman nun. Depende sa SOP. Merong assessment lang, diretso namang evaluation, tapos, intervention and then evaluation. Tatlo lang. Depende pa rin yan sa SOP mo. Pero ang standard NCP is you have your ADPI assessment, diagnosis, planning, interventions. Yung iba may rationalization, and then evaluation. That's ADPI. Okay? Tapos na tayo sa nursing diagnosis. Now we're gonna go to step 4, which is setting priorities. How are you going to set priorities? Now, setting priorities involves establishing a preferred sequence for addressing nursing diagnosis and intervention. In this step, the nurse and the client begin planning which nursing diagnosis requires attention first. Prioritization. Diagnosis can be ranked and grouped as having a high, medium, or low priority. Life-threatening problems should be given high priority. Huwag ka mag-alala, didiscuss natin sa susunod. But in terms of prioritization, you guys, those nursing diagnoses that you formulated based on your assessment, this is now the time that you are going to prioritize them based on urgencies and based on, based on urgencies. Those immediate things that needs to be prioritized first. Let's say pain over pain versus fall. Of course, you will prioritize pain. That's the immediate response in terms of That's the urgent in terms of urgency, because that specific patient will not be able to cooperate, will not be able to understand, and there's a high risk for fall if your patient is in pain. He might go out of bed. He might go somewhere else to try to roll over the bed to try to compensate to the pain. So pain is the priority. You see? Don't worry, I will be teaching you on the next slide. So, nursing diagnosis encompasses Maslow's hierarchy of needs. Ito po yung Maslow's hierarchy of needs natin, and helps to prioritize and plan care based on patient-centered outcomes. In 1943, just so you know, Abraham Maslow developed a hierarchy based on basic fundamental needs innate to all individuals. Basic physiologic needs, goals must be met before higher needs or goals can be achieved, such as self-esteem and self-actualization. Psychosocial and safety needs are the basis for implementing nursing care and interventions. Thus, they are the basis or the base of Maslow's pyramid, laying the foundation for physical and emotional health. Tatalakayan natin tong Maslow. Isa sa mga way na magpa-prioritize ka bago tayo mag-proceed sa Maslow is, ganito yan, ABC, airway, breathing, circulation, Maslow's. Right? May problem ka sa airway, hindi ka magpo-proceed sa Maslow. May blockage ka sa airway, bakit ka safety and security, which is under sa Maslow. ABC plus Maslow. That's how you're gonna prioritize your actions, your interventions. Nasa prioritization na tayo. Huwag kayo malilito, ha? So, ABC plus Maslow's. In this particular airway, breathing, circulation. That's what I'm trying to say. So, Maslow, i-discuss natin sila. Basic physiologic needs. Ano bang components ng Maslow's hierarchy mo? Ito siya, Physiologic, nasa bottom line part ng pyramid. Ito po. See this one? This. Kasi siya yung base. Bago ka umakyat sa safety and security, na-fulfill mo dapat muna yung physiologic needs. Bago ka umakyat sa friendship, family, and sexual intimacy, dapat na-fulfill mo muna yung security. Okay? Safety and security. That's the concept of Maslow's. So, by level. Now, ano bang laman ng basic physiologic needs? Alam nyo na to. Nutrition, water, and food. Basic. Elimination, toileting, airway, suctioning, breathing, oxygen, circulation, pulse, cardiac monitor, blood pressure, ABCs, sleep, sex, shelter, and exercise. Sex, yes. Diba na-emphasize ko talaga. Physiologic needs. Basic needs. Basic human needs. Okay? Now, we have safety and security. Huwag kayo malilito ha. Yung components sa Maslow, iniisa-isa ko lang. So, safety and security, which involves injury prevention. Example, side rails, call lights, hand hygiene, isolation, suicide precaution, fall precautions, car seats, helmets, seat belts. Fostering a climate of trust and safety, therapeutic relationship, patient education, modifiable risk factors for stroke, heart disease. I'm just giving you some examples on how you will see safety and security in the actual setting. Okay? Now we have love and belongingness, or love and belonging. Foster supportive relationships, methods to avoid social isolation, bullying. Example, employ active listening techniques, therapeutic communication, and sexual intimacy. Di ba sexual intimacy pa rin? We all need. Charing. Next, we have self-esteem, acceptance in the community, workforce, personal achievement, sense of control or empowerment, accepting one's physical appearance or body habitus. Self-esteem, dito papasok yung body image disturbance. Being part of a group, peer pressure, ito siya. Success in your career, self-esteem, boosting your morale. That's all about self-esteem. All right. We also have, which is the top part of the pyramid, is what we call self-actualization. Now, I believe I haven't reached this far yet. I hope so in my lifetime. I mean, I should reach, everybody should reach this top level of Maslow's hierarchy of needs. Self-actualization, kung di mo pa alam, empowering environment, spiritual growth, ability to recognize the point of view of others, reaching one's maximum potential to be the highest and truest expression of yourself. That's it. Maslow's hierarchy of needs, self-actualization. I believe Maslow's, and I truly believe that Maslow's hierarchy of needs comes with age and experience. As you grow older, you move towards past some life experiences, some challenges and hurdles in your life, and you will be able to experience all of the experience that this life have to bring, and you'll be able to somehow navigate through this Maslow's hierarchy of needs one at a time. Okay? The client's health values and beliefs, priorities, resources available, and urgency are factors the nurse must consider when assigning priorities. Priorities of your actions involve the client in the process to enhance cooperation. Hindi pwedeng solo-solo polite ka lang. Ikaw lang nagplano ng buhay ng pasyente mo. Kasama yung patient. Okay? Tanungan mo siya, ano bang gusto mo? Huwag ka mag-alala, tatalakay natin yon mamaya. But once again, this is how you were going to prioritize, which is your step 4. Let's proceed. Whew, that was lengthy. Step 5, establishing client goals and desired outcomes. How are you going to do this? Now, after assigning priorities for your nursing diagnosis, the nurse and the client set goals for each determined priority. Goals or desired outcomes describe what the nurse hopes to achieve by implementing the nursing interventions derived from the client's nursing diagnosis. Goals provide direction for planning interventions, serve as criteria for evaluating client progress, enable the client and the nurse to determine which problems have been resolved or ongoing pa, and help motivate the client and nurse by providing a sense of achievement. The example of these is going to be on the next slide. Kalma. Ito tayo, example of goals and desired outcomes. Bibigyan ko kayo ng examples. So ito tayo, for patients with decreased cardiac output due to heart failure, this is one example of your desired outcomes. Ito po yung disease or yung diagnosis mo, yung current situation ng pasyente mo. Cardiac output due to heart failure, decreased cardiac output. Anong pwedeng desired outcomes mo or goals mo? The client will demonstrate adequate cardiac output as evidenced by vital signs within acceptable limits, absence of dysarrhythmias, and no symptoms of heart failure. Period. Simple, right? For patients with ineffective airway clearance due to pneumonia, may problems sa breathing. After 8 hours of nursing interventions, the patient will display signs of effective airway clearance as evidenced by absence of dyspnea, difficulty of breathing, cyanosis, and respiratory rate within 12 to 16 breaths per minute, which is your normal range. Lastly, one good example of your goals and desired outcomes for patients with acute pain, mga may chest pain. Acute pain, chest pain. Client will demonstrate the use of appropriate diversional activities and relaxation scales and will report pain at less than 3 to 4 on a rating scale of 0 to 10, 10 being the highest. Ang baseline pain scale mo is, let's say, 7. So, madidecrease siya from 3 to 4. Attainable naman to. O, magbibigay ka ng diversional activities, magbibigay ka pa ng pharmacological treatment. O, di ba, bongga? So once again, these are the examples of your desired goals and desired outcomes. How are you going to look at it? How are you going to write it and try to formulate? Make a screenshot. This is for you. All right. One overall goal is to determine for each nursing diagnosis, the term goal outcomes and expected outcomes are often used interchangeably. All right. So that's one key note. Now, one of the things that you need to do in formulating you need to think about in formulating your plan is this acronym SMART. SMART. Now, according to Hamilton and Price in 2013, goals should be SMART. SMART stands for specific, measurable, attainable, realistic, and time-oriented goals. Now I'm teaching you how are you going the components and the contents of your planning, which is it has to be SMART. Don't worry, I will discuss it to you one by one. S stands for specific. Specific, it should be clear, significant, and sensible for a goal to be, effective. Specific to the patient's concern. That's what it is. Measurable or meaningful. Making sure a goal is measurable makes it easier to monitor progress and to know when it reaches the desired result. Measurable meaning, example, pain scale, baseline mo 10. Tapos nilagay mo sa desired outcomes mo, sa planning mo, to decrease to at least 3 to 4. Were you able to measure it? Yes, because you have an actual figure to measure your goal, if it's effective or not. That's how you're going to make sure that it's measurable. Attainable or action-oriented goals should be flexible but remain possible. Meaning, you'll be able to navigate through the actions that you're going to do. Don't set goals that is impossible to do because that could lead you to failure. All right, realistic or results-oriented, meaning this is important to look forward to effective and successful outcomes by keeping in mind the available resources at hand. Checking your resources, availability of your resources, your time, your that also includes your. Hold on, let me change my position for a bit. Your your realistic goals, your effort and your energy and the patient's energy level, the patient's cooperation level. That's one way of making sure that you set realistic goals. Bawa post-op, pinaglakad mo na agad in 10 minutes. Posible ba yun? Or post-op, wala agad pain pagka-receive mo from post-op, from PACO. Oh. Is that realistic? No, not realistic. Next, T stands for timely or time-oriented. Every goal needs a designated time parameter, a deadline to focus on, and something to work toward. Yung nakikita mo within 8 hours of nursing intervention, or within 4 hours of nursing intervention, or within 1 hour or 30 minutes of nursing intervention, the patient will be able to, let's say, be able to, be able to walk. Let's say post-op within 8 hours of, within 8 hours of nursing, depende pa rin ha. Within 8 hours of nursing intervention, the patient will be able to walk with assistance. Okay, that's you're gonna make sure that it's time bounded or time oriented. Once again, this is the concept of your SMART. Now I'm gonna be teaching you 2 types of goals. Ako ng dada dito. Kung di ka pa nagsasubscribe, mag-subscribe ka muna. Go! O, diba? Ang bilis lang. Eto na. Now, may dalawang klase ng goal. Meron tayong short-term and long-term goals. Parte to ng planning. Lalagay mo doon, long-term goals, tapos sa baba, short-term goals. Okay? So, sa short-term goals, ito po siya. Short-term goals, okay, so short-term and long-term goals. Goals are and expected outcomes must be measured, measurable, and client-centered. Goals are constructed by focusing on problem prevention, resolution, and rehabilitation. Goals can be short-term or long-term. Most goals are short-term in an acute care setting since much of the nurse's time is spent on the client's immediate needs. Long-term goals are often used for clients who have chronic health problems or live at home, in nursing homes, or in extended care facilities. Now, let me explain to you what I'm talking about here. Short-term goal. You say a goal is a short-term goal. This is a statement distinguishing a shift in behavior that can be completed immediately, usually within a few hours or 30 days. 30 days or days. Example, within 30 minutes of nursing intervention. Example, within 1 hour of nursing intervention. Example, within 6 hours of nursing interventions. That's your short-term goal. You will say that your goal is a long-term goal if it indicates an objective to be completed over a longer period, usually weeks or months. Pag weeks or months na, ang goals mo, ang time frame na nilagay mo sa goals mo, dun sa planning mo, that is your long-term goal. We also have your discharge planning. Discharge planning involves naming long-term goals, therefore promoting continue restorative care and problem resolution through home physical therapy or various other referral sources. Baka may referral yan sa home health care. That's your discharge planning. Okay? Compliance to home healthcare treatment. Mga ganon. Once again, this is your short-term and long-term goals. Nakakahinga pa ba kayo? Of course, I told you this is going to be juicy. Juicy. Next, we have your step 6, selecting nursing interventions. How are you going to select your nursing interventions? Makinig na mabuti. Madali lang yun. Okay, mag-alala, hindi ka mag-iimbento for today's video kasi kagamit ka ng Nanda. Eto na. Nursing interventions are activities or actions that a nurse performs to achieve client goals. Interventions chosen should focus on eliminating or reducing the etiology of nursing diagnosis. Kung ang etiology mo is, for example, risk for pain. Ang etiology mo doon is, ang diagnosis mo is risk for pain. Ang etiology mo doon is pain. Risk for pain. That's your etiology. Okay? Pinaka-problema mo. As for risk nursing diagnosis, intervention should focus on reducing the client's risk factors. In these steps, nursing interventions are identified and written during the planning step of the nursing process. However, they are actually performed during the implementation step. Eto na tayo, types of your nursing interventions. Nursing interventions can be independent, dependent, or collaborative. Oh, nalula ka na. Huwag ka mag-alala. Nasa Nanda din to. Explain ko sa iyo ano ibig sabihin ng mga terms na yon. Independent nursing interventions, makinig, are activities that nurses are licensed to initiate based on their sound judgment and skills. Includes ongoing assessment, emotional support, providing comfort, teaching, physical care, and making referrals to other healthcare professionals. That's your independent nursing nursing interventions, meaning something that you can do on your own, independently. Okay, mga actions na pwede mong gawin on your own, such as giving medications, suctioning, starting the feeding, doing referrals to social worker, to wound care, the dietitian. Mga ganon. Next, we have your dependent nursing interventions. Dependent nursing interventions, meaning you need other people. You're depending to other people's actions. I'll explain. Are activities carried out under the physician's orders or supervision, meaning starting of narcotics. You can't do that on your own. You need order. So that's dependent nursing intervention. Right. Now includes orders to direct the nurse to provide medications, intravenous therapy, diagnostic tests, treatments, diet, and activity or rest. Assessment and providing explanation while administering the medical orders are also part of the dependent nursing intervention. Explanation of procedures and certain medications to the patients. That's dependent nursing interventions, because you need the doctor to do that. Interpret some lab results, interprets the results of the let's say biopsy or ultrasound. That's the doctor's role, so you need them. Okay, the last type of intervention, familiar ka dito, collaborative interventions, are actions that the nurse carries out in collaboration with other healthcare team members, such as physician, social worker, dietitian, and therapists. These actions are developed in consultation with other healthcare professionals to gain their professional viewpoint. Example, sa pasyenteng naka-ET, gumawa ka ng referral sa respiratory therapist to see the patient do suctioning, deep suctioning. That's type of collaborative intervention. You're asking for the inputs of the RT regarding the current airway and breathing pattern of your the mech vent setting of your of the patient who is on ET, endotracheal tube. That's collaborative interventions. Okay, you're doing referrals to dietitian, wound care because there's pressure injury. That's collaborative, right? You're doing referrals to social worker. Why? Because the patient is uncompliant and refusing some of the medications and nursing procedures and let's say MRI or whatever. That's referral to social worker is considered collaborative interventions. Malinaw? Malinaw. Next, we have, when writing nursing interventions, all you gotta do is to follow these steps. I'll make it simple for you. Don't worry. I divided it into 3. First one, write the date and sign the plan. The date the plan is written is essential for evaluation, review, and future planning. The nurse's signature demonstrates accountability. Okay? Next, nursing intervention should be specific and clearly stated, beginning with an action verb indicating that the nurse is expected to do. Action verb starts the interventions and must be precise. Qualifiers of how, when, where, time, frequency, and amount provide to content of plan activity. For example, example niya, educate parents on how to take temperature and notify of any changes or assess urine for color, amount, odor, and turbidity. Assess, educate, that's the action word. Right? Right. Lastly, use only abbreviations acceptable by the institution. You don't get to use any not unacceptable abbreviation by your facility. Nasa SOP yan ng hospital niya. Pwede naman gumamit ng abbreviations, pero yung acceptable lang per hospital. May SOP yan. Basahin mo yun. Step 7, malapit na tayo matapos. Nako, eto na talaga. Step 7, providing rationale. Yung ibang NCP wala ng rationalization, pero yung mga student NCP, naalala ko nung estudyante pa ako, gumagawa ako nito ng rationalization, parte yan ng column. Rationales do not appear in regular care plans. They are included to assist nursing students in associating the pathophysiological and psychosocial principles with the selected nursing interventions. The examples of your nursing rationales is going to be the next slide, but let me just reiterate this. Kapag estudyante ka, tas iritang-irita ka kahit hindi mo nalalaman yung rationale, kung bakit pinapasulat pa yung rationale, dagdag sa column, dagdag sa susulatin, wag kang dahil meron yang rationale or may dahilan yan. There's a reason why. Because rationalization is basically the basis. Why are you doing such actions, such interventions? Kapag nagsulat ka ng rationalization, katapat nun yung sa nursing intervention. Okay? Bakit ka let's say, positioning? Bakit ka magpo-positioning? To prevent, to promote circulation. Why are you going to explain the procedure to the patient to establish rapport? To increase, to increase patient cooperation. Why are you going to introduce yourself to the patient upon receiving during bedside handover? Why? Why are you gonna do that? To decrease level of anxiety. Why are you going to administer pharmacologic? Why are you going to give pain medication? To decrease the level of pain. Laging may why. That's the rationale all about. The thing about nursing, and something that I really learned in my more than almost 10 years of being a nurse, is that you have to ask why. Even to your doctors, why are you ordering this? Why? It's okay if you ask why. There's nothing wrong with that. It's actually, you have to have a basis of the things that you do. Hindi yung parang gagawa ka lang. Pag sinabing lundag sa building, lundag, hindi ka magtatanong, bakit ako lulundag? Ganun. Pag sabing kain tae, ganun. Huwag kang parang puppet. Huwag kang parang robot. Ask why. That's your right as a nurse. Okay? Now, here are the examples of nursing intervention and rationale. Nursing intervention po yun sa kabilang side. The other side is rationalization. This is how you're gonna write it on your NCP. Ito ay student NCP, ha? Ewan ko sa facility nyo, pero kami wala na kaming rationalization sa area namin. So, example, nursing intervention, perform comprehensive assessment of pain, determine the location, characteristic, onset, duration, frequency, quality, and severity of pain, via assessment. Rationale, bakit mo yung gagawin? The patient is experiencing pain. The patient experiencing pain is the most reliable source of information about their pain. Subjective kasi ang pain. Thus, assessment of pain by conducting an interview helps the nurse in implementing optimal pain management strategies. Provide cognitive behavioral therapy, CBT, for pain management. Bakit mo yung gagawin? Bakit ka magsi-CBT? These methods are used to provide comfort by altering psychological response to pain. Cognitive behavioral interventions include distraction, guided imagery, eliciting relaxation, response, etc. So once again, these are the examples of your nursing intervention and how you're gonna write your nursing intervention. My nurse's pocket guide ka, basahin mo yun. Nandun rin yung rationalization, naka-italic. So, di ba, alam na alam ko. Kasi, believe it or not, talagang binasa ko tong nandat. Ginagamit ko talaga siya. Favorite ko yung pagpo-formulate ng NCP, actually. Diba? Inaral ko siya. Eto na tayo. Step 8. Evaluation na. Nasa last part ka na tayo ng ADPI. ADPI, remember? Evaluation. Eto na. So, evaluation is a planned, ongoing, purposeful activity in which the client's progress towards achieving goals or desired outcomes is assessed. In the effectiveness of the nursing care plan, or your NCP, evaluation is an essential aspect of nursing process because the conclusions drawn from this step is determine whether the nursing intervention should be terminated, continued, or changed. Dito ka na maglalagay ng goal met or goal not met. Nalala. Next, step 9, putting it on paper, which is the last part. Before I reveal how are you going to put it into actual practice, mag-subscribe ka na, go. Woohoo! Can you imagine? I've been talking like more than 39 minutes for almost 40 minutes here. Alright, nakakahinga pa ba kayo? Nakakahinga pa. Mahaba ito. Balikan mo ulit ako bukas. Huwag ka mag-alala. No time pressure. Okay, so how are you gonna put it into paper? That's what you're gonna find out on the next slide. Eto na tayo. So putting it in paper, the client's care plan is documented according to hospital policy and becomes part of the client's permanent medical record, which may be reviewed by the oncoming nurse. Different nursing programs have different care plan formats. Most are designed so that the student systematically proceeds through the interrelated steps of the nursing process, and many use a 5-column format. Ang sa evaluation mo lang naman, sasagutin mo lang yung nursing intervention mo, each of them, o yung nursing planning mo. Bawa, within 8 hours of nursing intervention, the patient will be able to report decrease of pain from 10 to 3 to, let's say from 7 to 3 to 4, with 10 being the highest. So, sasagutin mo yon sa evaluation mo. Within 8 hours of nursing intervention, the patient reported decrease of pain from 7 to 3, with 10 being the highest. Goal met. O, diba? Yun siya. So, expectations on next uploads, guys. Huwag kayo mag-alala. I'm going to give you list of sample nursing care plan or NCP and nursing diagnosis for various diseases and health conditions. They are segmented into categories. I'm planning to put it into categories. Huwag kayo mag-alala. Per conditions, health conditions. Eh, di ba exciting? Ito na talaga. So, thank you so much. That is the end of our discussion for today. I hope you learned something. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have other nursing topics you want us to do. Comment it down below. Abangan mo nga yung upload natin next week because that's going to be another sets of discussion, another week for lecture. I'm gonna give you this weekend to relax, unwind, and get your life back. But on Monday, I'm expecting you to come back. And thank you so much once again, from the bottom of my heart. I really took my time to do the slides for you and to present this to you in the best way I can. I hope you guys appreciate it, and I really hope that you learn something. Tulungan nyo na nga ako, ipamalitan nyo na sa Radyong Sirang pinakabago, pinaka-fresh at ang pinakalibreng nursing review center sa balat ng YouTube. Don't forget to follow me on all my other social media accounts. Everything is at Neil Galve except for my TikTok account, which is Neil Galve Official. I have a podcast. It's 3 a.m. Conversation with Neil Galve. Check that one out. It's all for you. And I'll see you again next week. Have a good weekend.